Hi, I'm Dr. Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of interventional orthopedics and orthobiologic procedures. So the two options that we have at Regenexx Pittsburgh are either Regenexx SCP or Regenexx SD. SCP stands for Super Concentrated Platelets, also known as PRP. We use super concentrated platelets in treating rotator cuff injuries when the injuries are more minor. So when somebody has chronic tendonitis or a smaller partial thickness tear, platelet treatment works great, and that is what we would recommend. In patients that have a more complicated or full thickness tear, that's where we get into the Regenexx SD procedure, SD meaning bone marrow concentrate containing growth factors and stem cells. The reason we use the more advanced SD procedure for the bigger problems is it works better to solve those problems. Bone marrow concentrate, which contains growth factors and mesenchymal stem cells, these cells have the ability to help the rotator cuff that is even a full thickness tear repair itself, so surgery is not necessary. These are the advanced healing cells that we have in our body that have the ability to create a significant healing response in these damaged areas. The other time that we will use the bone marrow concentrate or SD procedure is in the setting of a rotator cuff injury with arthritis, which is also very common, especially in the elderly. Because in those instances, we not only want to treat the rotator cuff, but we also want to treat the arthritis. Because if you only treat the rotator cuff without addressing the underlying arthritis, the outcome won't be as great. The reason we use orthobiologics, whether we're talking about the SCP platelet procedures or the SD bone marrow concentrate procedures, is we are flipping the odds in your body's favor. So yes, your body is trying to heal this problem already with the platelets and the growth factors and stem cells that you have. However, you do not have enough in the actual area where the problem is. So if we can gather those from another part of your body, be it from your blood where the platelets are contained or from your bone marrow where the stem cells are contained, and we can take about 1 billion of those and concentrate them and put them right into where the tear is or where the damage is, your body now has the ability, because of the number and the potency of those cells, to heal the problem.